and colleagues, I do want to open by saying that I thought this was a fairly straightforward bill as well, so I hope it's somewhat easier than the previous one.
Is there bail involved?
No bail involved.
Good.
No bail involved. Just brace and bolts. AB 1440 recognizes the existence of Brace and Bolt program and provides funding to California Residential Mitigation Program upon appropriation by the legislature for continued and expanded implementation of this grant program. The Brace and Bolt program, administered by a joint powers authority between the California Earthquake Authority and Governor's Office of Emergency Services, provides single-family homeowners with up to $3,000 to make the most basic but vital seismic improvements to the foundations of their homes. Throughout the last few decades, we have discovered that buildings built preceding updated building code standards pose a significant threat to residents. Brace and Bolt has been effective in helping hundreds of homeowners strengthen their buildings to lessen earthquake damage to their homes and save lives. Homeowners who retrofit also may qualify for steep discounts on earthquake insurance, which might help get more Californians insured. Currently, only homeowners in specified zip codes are eligible for the program. It is my hope that with additional funding, other California residents can be able to take full advantage of this program. Other cities, including those in my district, which are not eligible for this program, would greatly benefit from Brace and Bolt. With me is Robert Harrell from the Department of Insurance.
Is there a second? There's a motion and second on the bill. Please go ahead, Mr. Harrell.
Mr. Chairman and members, Robert Harrell with the Department of Insurance. Switching gears completely from the previous issue, Brace and Bolt is a great program. Herein lies the rub. We've got 1.2 to 1.6 million homes that need some help here. For $3,000, $5,000, in some cases $7,000, folks can retrofit. At some level, what we need to do is scale up this program. So we want to thank Assemblymember Nazarian. There's a partner bill you're going to be hearing later on today by Assemblymember Chu. It's important that the legislature and we see other parties like LA getting more and more involved in this area, that we collectively figure out a way to try to get the resources so that more people can protect themselves for their most important asset. With that, we'd ask for your aye vote.
Thank you, sir. Witnesses in support?
Good morning. Yeli Godrich with the California Association of Realtors, and we're very aware that earthquakes are not if, but when, and so we think this is a great bill for homeowners, and we appreciate it. Thank you.
Thank you.
Mr. Chair and members, Sean Tepekian with the California Apartment Association. We want to thank the author for bringing this measure forward. Seismically retrofitting small apartment buildings are some of the most expensive things property owners can do, and this will go a long way to ensure that tenants are safe in these small communities. Thank you.
Thank you very much. Anyone else in support of this measure? Are there any witnesses opposed? Committee members, any questions or comments? Mr. Frazier.
Thank you, Mr. Nazarian. In my former life, I'm a registered seismic retrofit contractor also, and I was registered from the Department of Insurance through their seminars and FEMA. And so I want to know, in the process of who's going to dictate what is the highest priority on that single dwelling of what gets fixed? The contractor, the owner, the granting agency? Because there's many components. You can minimize damage by retrofitting, but you can't effectively remove all damage. And so is it bolting down to the foundation? Is shear walls? Is it hold downs? Who's going to determine the best value of how this money is being spent on the retrofit?
Thank you for the question. I'll have Mr. Harrell respond.
Assemblymember Frazier, thank you very much. Part of the answer to that question, I think, lies in where we are in the state, what kind of home we're talking about, when it was built. We've seen as different generations of homes get built, certain things are better and stronger, and so that means other things would need to be fixed. I'm certainly no expert in this area, nor do I claim to be. But under the existing program, which is more in a pilot form, I think this year they're going to do 500, 600 homes, which is great, but considering the magnitude of the problem, therein lies the rub. Those decisions are being left to the experts who have expertise in the field here. And I know, well, I think the CEA is here in the room today, but I know that they've been working with all the interested parties. The Commissioner is one of the voting members of CEA to make sure that the scarce resources that are there now for this program are spent as efficiently as possible because, as you know, it's a relatively small amount of money that can make a big difference. Doesn't mean that there's no damage, but it means that the home, for example, doesn't fall off the foundation, essentially, which is critical, as opposed to relatively minor damage by comparison.
And I go back to the fact that there's many components of retrofitting, but again, the value of what can be accomplished with that minimal amount of money is essential. That you really recognize that basically, you know, if somebody says that they just want to put hold downs in and there's not enough anchor bolts in the foundation and it slides off and it only had a corner, so that it concerns me to make sure that it's used in such a fashion that it's the best spent value.
Right now, in the program, which again is pretty small in scale, there's sort of requirements of eligibility that deal with some of those very issues. Not all of them, but some of those very issues.
Okay, and also that it is a permitted through the building department process going forward, that inspections and signed off, and actually hopefully through that process that a copy of the building permit is sent as validation that it has been done. Would be helpful also. Thank you.
All right, any other questions or comments? If not, there's a motion and second. Roll call. Would you like to make any closing comments, Mr.
Thank you for
Nazarian?
doing it for me.
All right.
Appreciate it.
Anytime.
Thank you.
Roll call vote, please.
Daly.
Aye.
Daly, aye. Beth Gaines. Travis Allen. Calderon. Calderon, aye. Cooley. Cooper.
Aye.
Cooper, aye. DeBobne. DeBobne, aye. Frazier. Frazier, aye. Gatto. Gatto, aye. Gonzalez. Grove. Grove, aye. Mays.
Aye.
Mays, aye. Rodriguez. Rodriguez is aye. 1, 2, 9 votes.
9 votes. The bill is out, Mr. Nazarian.
Thank you.
You're welcome. Next in the sign-in order is Mr. Perea. This is Assembly Bill 1124. Welcome, sir.
Thank you. Thank you, Mr. Chair and members. AB 1124 is a measure that would require the Administrative Director of the Division of Workers' Compensation to establish a prescription drug formulary in California's workers' compensation system. The development of the formulary would involve a stakeholder advisory committee and would take effect no later than January 1st, 2017. Establishing a formulary is not a new concept and has been adopted in other states' work comp systems and is widely used in group health, Medi-Cal, Medicare, and other federal health care programs. A formulary is a list of approved drugs that define the scope and in some cases limit the variability in prices for certain types of drugs. Because our current system lacks a formulary, there is a clear opportunity to provide significant benefits to our system and injured workers get back to work. In October 2014, a report published by the California Workers' Compensation Institute found that a formulary in California could save anywhere from $124 to $420 million per year. In addition to cost savings, formularies have the potential to limit the overutilization of highly addictive medications and ensure injured workers are receiving proper levels of treatment. The stakeholder advisory group would ensure that evidence-based medications would be used in the right situations while ensuring injured workers get the necessary treatment they deserve. In closing, I just want to thank the committee and their staff for their work on the issue. I know that we have some opposition and some concerns that have been stated. I think that we can find some reasonable solutions to some of those concerns, and we've been talking with the opposition about that. And would just respectfully ask for your aye vote. And with me is Alex Swedlow from the California Workers' Compensation Institute. Thank you, Mr.
Thank
Chair.
you, Mr. Perea. Please, the witnesses in support.
Good morning. My name is Alex Swedlow, and I serve as president of the California Workers' Compensation Institute. For 51 years, we've been conducting research on various cost drivers within the system, and I'd like to thank the chairman of the Assembly Insurance Committee, Tom Dudley, for the opportunity of speaking today. I've passed out a series of slides that I'm going to use for my notes rather than just refer to the formal study that we've also provided. I'd like to begin with just a quick primer on the state of pharmaceutical delivery in workers' compensation compensation. We are currently spending approximately $1 billion, actually a little bit more than $1 billion a year on pharmaceuticals. And we have tried over the last 10 to 15 years a variety of different methods to control the inflation of that spend. We've tinkered with fee schedules in 2002 and 2004 and 2013. We've implemented guidelines, evidence-based medicine. It is a significant cost driver in our medical dispute resolution process. Utilization review and our new independent medical review, which went into play in SB 863, over 45% of all medical dispute resolution concerns pharmaceuticals, which represents a significant cost drag on the system of hundreds of millions of dollars a year. And here we are with what we consider to be a potential missing piece, the consideration of a formulary in AB 1124. If you turn to page 2, you'll get a quick picture of where we are in terms of our pharmaceutical inflation in workers' compensation. Between 2004 and 2012, if we measure the first 2 years of pharmacy spend for a typical injured worker, it's increased by over 250%. Last year, it grew by 19%, and that was on top of a 26% increase the year before. So there doesn't seem to be any let-up in the escalation of the cost. If we consider pharmaceuticals as a proportion of all medical benefits, it's grown from about 7% to now over 13% in that first 2 years. And as the claim ages, as an injured worker goes into his 5th and 10th year, it's not uncommon to see it become 20% of all the costs related to medical care delivery. Part of the problem, and I'm now on page 3, relates to the expensive and protracted use of opioids, and in many cases, the use of opioids that aren't in agreement with the evidence base. The application of Schedule II opioids, the most powerful opioids delivered, just aren't appropriate in terms of science, and yet we have been delivering those drugs in ever-increasing amounts. The cost of the drugs have been increasing significantly, over 210% increase in brand-name drugs and 163% increase in the number of prescriptions. We have tried in the past to curtail these in a variety of ways. Assembly Bill 378 was an attempt to control compound drugs, and it was a good illustration of how nimble the pharmaceutical manufacturers can be. Shortly after passing that bill, the price of the compound drugs, despite the attempt to control it by fee schedule, increased by 68%. So it's with all these attempts to control the pharmaceutical spend by fee schedule amounts and by guidelines, we find ourselves with this great opportunity to strongly consider a formulary. Our recently published study in October 2014 lists some basic reasons why this might be appropriate. On page 7, we consider the basic question, what is a formulary? It's really nothing more than a list of approved drugs that define the scope and in some cases the price of a particular pharmaceutical. There are different kinds of formularies. There's dozens, hundreds of different types of formularies in play. There are essentially two kinds, one that's inclusive, a long...
You want to wrap up, sir?
Sure. The research clearly shows that we spend too much on pharmaceuticals. A formulary such as used in Texas and Washington has the opportunity of bringing down costs between 10 and 50%, or up to $500 million a year to the California system.
Thank you, sir, very much. Witnesses in support, we're continuing.
Thank you. Melissa Cortez-Roth on behalf of Comp Pharma. Comp Pharma is made up of pharmacy benefit managers that operate in the workers' compensation market. Our companies do have formularies today as part of our clients' utilization review plans, but we are very limited in what we can do. We do work in all of the states that have statewide formularies. We've seen great success. We think we can take what we've learned from some of those other states and craft something that's unique to California that controls costs but also provides sufficient access to injured workers.
Thank you.
Mr. Chair and members, Jeremy Merzenbaugh, the California Chamber of Commerce. We'd like to thank Assemblymember Perea for his leadership on this issue. We understand this is going to be a process that we're starting a discussion, but for the aforementioned reasons, there are a number of benefits that can come from this process. We think and hope that while there may be some compromises, there are discussions that need to be had, we can create a viable fee schedule and create a better comp system. So with that, we are in support and urge an aye vote.
Thank you. I need to go to appropriations for about 3 minutes. Mr. Frazier will chair the meeting until I return. Thank you.
Thank you, Mr. Chair and members. Jason Schmelzer on behalf of the California Coalition on Workers' Compensation and CSAC Excess Insurance Authority. Just one comment. California's workers' comp system is the most expensive in the United States. This is a good step in the right direction to help bring that down. So we urge your aye vote.
Next witness in support, please.
Thank you, sir. Julianne Broyles here on behalf of the California Association of Joint Powers Authorities, also in support of creating a good science-based formulary for the workers' comp system.
Mr. Chair, Armand Feliciano on behalf of the Association of California Insurance Companies. We too support the bill. Thank you.
Good morning, Mr. Chair and members. Aaron Norwood on behalf of Liberty Mutual Group and Zenith Insurance Company in strong support of the bill. Thank you.
Amber King with the Alpha Fund, also in support.
Any other witnesses in support of the bill?
Ken Eichler, Work Loss Data Institute. I'm a nationally recognized specialist in treatment guidelines and formulary. I think a lot of folks here are focusing on the dollars and cents. I think a bigger concern is the impact to the health and well-being of the injured workers of California. In 2010, there were enough pain meds prescribed in this country to medicate every American around the clock for an entire month. There were 114 daily overdoses, 80% of which were unintended overdoses. The formulary will help improve quality of care, safeguard injured workers against risky medications, and expedite the delivery of appropriate medication to injured workers. The formularies for workers' comp differ from commercial formularies, which are financially driven and are based upon evidence-based medicine. Therefore, it will, again, improve the quality. It basically creates two buckets, a bucket of drugs which could be pre-approved for expedited authorization, and a second bucket, not a bucket that denies the care, but requires further investigation and specific authorization rather than pre-authorization based upon documentation of medical necessity for that specific individual. So in all other jurisdictions, it significantly cut costs. Texas, it cut prescribing, more important than cost. Prescribing of opioids by physicians was cut by over 60%. And when we went back to the physicians in Texas and asked why, they basically said it enabled them to, in the words of Nancy Reagan, just say no. Thank you. We are in support.
Next witness in support, please. State your name and who you represent.
My name is Mark Pugh with Prima. We're a national medication management company based out of Duluth, Georgia. I've been following the formularies around the country as well. I actually spoke at the National Work Comp and Disability Conference in November 2012, and at that point opined that California was a good target candidate for a closed formulary. So I'm a very strong believer in it. I believe that evidence-based medicine should be the basis. It should not be about saving costs, but it should be about what's best for the patients. In my opinion, true success from a drug formulary would be a decrease in disability, a decrease in addiction and dependence, an increase in return to work, and an increase in the use of less dangerous drugs. And so I believe that you should vote aye for this. Thank you.
Thank you. Any other witnesses in support? Seeing none, any witnesses in opposition? Please state your name and who you represent, please, and you may proceed.
Thank you, Mr. Chair, members. Mitch Seaman with the California Labor Federation. We actually have a support if amended position on this bill. Never been a tweener before, so I'm not really sure where to come up. Hopefully I'm here at the right time. Where we are in this bill is that we in no way fundamentally oppose the idea of a workers' comp formulary. We share the employer concerns over rising costs in certain areas of the system. While we believe 863 in 2012 did do a lot to deal with the issue, it's a big system. There's always room for improvement. And so we think that the concept is fine, but in addition to carrying the potential for great cost savings, it also carries a pretty significant potential of risk from the worker perspective, where fundamentally the idea of limiting the drugs that are available to injured workers, it can really go either way. The examples that are always cited are Texas and Washington State. Washington State eliminates not just individual drugs, but entire categories of drugs. And so when we look at things like that, it does generate some concerns for us. And so we think that the fundamentals of the bill are fine. Creating an advisory committee makes sense, but we'd really like to see some guiding principles that sort of dictate where the committee can go and that make sure that it contains some protections for injured workers. The elephant in this room is always disputed opioid treatment. And while we also share concerns over the devastating impacts to injured workers of unnecessary opioid treatment, the fact remains that for many injuries and for many especially acute pain management situations, that workers do have a real need for opioid treatment, and they usually have a need for that treatment quickly, that it doesn't work for them to have to go through some 2-month-long process where they deal with this dispute and then get the treatment that they need for the pain that they're experiencing during that entire time period. And so we'd like to see a guiding principle included in the bill that makes sure that when it's medically necessary, that treatment's available and that it's available quickly. And we'd also like to see something that includes a tapering off provision for workers who have developed addiction issues, that when the formulary goes into effect, let's say January 1st, 2017, that those workers aren't just cut off. I think we could all agree that that could be a pretty negative outcome for everyone involved. There's also an issue around off-label use where there are injured workers out there who have tried a variety of different treatments for their injury and not found any relief until they've used a drug for a purpose that it wasn't originally intended for. And so we'd want to make sure that there was a process in place to make sure that workers could still continue getting that off-label treatment when it's medically necessary. And finally, we'd like to see some sort of a principle in the bill that ensures when there's a new drug that's developed and it needs to be added to the list that happens quickly, that we wouldn't want to see workers have to wait for years or something for the committee to get back together or whoever adjusts the formulary to get back together and then add those drugs. And we're happy to work with the author's office and look forward to doing that, but just in general, we'd love to see those principles reflected in the final bill. Thanks.
Thank you, sir.
Thank you, Mr. Chairman. Carl Brackensick on behalf of the California Society of Industrial Medicine and Surgery, the California Society of Physical Medicine and Rehabilitation, and the California Neurology Society. We are not officially in opposition to the bill, but we have the same concerns that the Federation just expressed. This is a very complicated issue, and as we all know, the devil is in the details. And the proponents, as well as the analysis, have indicated that this is a work in progress, and certainly there are a number of issues that need to be addressed, we feel, by the legislature before this bill is delivered to the governor. For those of you who followed the hearings in the Senate on March 25th, a number of witnesses acknowledged missteps that were made in the implementation of SB 863. A drug formulary is another major step in workers' compensation, and there is a definite need for the legislature to exert greater oversight in the implementation of this new program. For example, we would suggest that the advisory committee that the administrative director is supposed to create, that there be some review of the membership of that advisory committee and approval of the members by the legislature, perhaps by this committee, also by the Senate Labor Committee. Secondly, any reports of the advisory committee that are delivered to the administrative director, we feel should be delivered simultaneously to this committee for review so that you can monitor the evolution of the development of the formulary. There's nothing in the legislation that prevents the administrative director from ignoring the recommendations of the advisory committee. And in fact, as drafted, the deadline for the advisory committee to report is 1 day prior to the mandatory adoption of the formulary by the AD, thereby theoretically giving no time whatsoever for the regulatory process which is going to be inherent in the development of this formulary. We believe a well-designed formulary can maintain access to care. It can reduce utilization review and IMR costs, which are borne by either the providers or by the insurance companies and employers. And it'll also reduce the primary product costs. So there are certain benefits that do come from formularies. We think they are valuable. We know there's a role for them in workers' comp, but we have to make sure that it's done right the first time. Thank you.
Thank you, sir.
Thank you, Mr. Chair. Mike Carroll with the California Applicant Attorneys Association, and we concur with the two previous witnesses from the Labor Federation and CSIMS in their concerns around the bill. And the one thing that we would additionally say, I mean, we fundamentally do support a formulary. We do think this would be useful for us to go forward, but we do have to get the details right. And one of the details that we really want to make sure we get right is that this doesn't result in another opportunity to delay medical treatment and care for injured workers. And we don't want to have this subject where the employer who gets to pick the doctor and who then prescribes something off the formulary, that could be then further delayed by utilization review, other delays by the carrier. So we do have concerns about making sure that there's no further delays in the process, that drugs that are on the formulary are recommended by the doctor chosen by the employer would actually be able to get those medications promptly.
Thank you, sir.
Stuart Thompson on behalf of the California Medical Association. I'd like to echo the comments of the previous speakers. We are looking for an amendment as if a provider does prescribe a prescription that is on the drug formulary, we believe that that prescription should not be subject to utilization review. We are worried about employers denying or modifying treatments and injured workers not getting prompt care.
Great. Any other witnesses in support? And thank you, Mr. Frazier, for chairing there for a few minutes. Witnesses in opposition? That was opposition, excuse me. Wasn't quite clear there for a while. Any questions by committee members? Questions? Mr. Frazier.
Mr. Perea, one of the things that has been kind of glossed over is there still is an IMR process that goes through, that if somebody has an issue with the protocol that's been given to them, that there actually is a process for appeal.
Right.
And also, in our efforts with workman's comp, and I applaud you for looking at this to bring down the cost, because the more money we can save on workman's comp, we can hire more people. Would it be fair to say that an investment in safety before the fact as a preemptive measure would also be a process that would also help this? So if the industry likes to be preemptive and also help in the safety component with the workforce, then we won't have to spend so much money on medicine.
Right, absolutely. I mean, I think we need to look at this, in two ways. One is certainly savings for business, for small business, so we can do the things that you mentioned, continue to hire more workers. But this is also about injured workers and making sure that they get the right care that they need to get back to work.
Mr. DeBobny.
I just want to thank the author. This is obviously, I think, an issue that affects every business in the state. I think that obviously the cost savings are really important because, unfortunately, a lot of the cost savings that came out of the last compromise piece of legislation a few years back have not been realized, and we've actually seen an increase in costs, especially around drug usage. And really, I think one of the previous speakers in support kind of hit the nail on the head. This really is about affecting the injured workers' lives. We have a number of studies that already show the dependency rate on some of these opiates is skyrocketing in the last few years, and there's a small percentage of doctors that are prescribing the overwhelming majority of these prescriptions. So I think when you look at this piece of legislation and you look at Section A and Section B when it talks to quantity restrictions and refill restrictions, those are just common sense measures. The fact that this is just going to make sure that people aren't abusing the system, that injured workers are able to get back in the workforce, get their quality of life back, and aren't going to become dependent on these opiates, I think is as valuable as the cost savings. I applaud your efforts, and I look forward to voting for this bill today.
Thank you.
Other questions? Ms. Grove.
Thank you, Mr. Chair. I'd like to thank the author for bringing this forward. And although, as a business owner in the real world, I appreciate the possible savings that could come from this, I really do appreciate the fact that specifically on the formulary that Mr. DeBobny addressed, there's countless prescriptions that before this prescription is due to be refilled, medical providers are refilling those prescriptions, and people are being highly addicted to opiates and strong pain medications, which is essentially affecting their lives. To the opposition's argument that having the injured worker on this, there is a benefit specifically, not to this opposition here under labor, but specifically for the trial lawyer opposition or the applicant's attorney opposition, that the longer they're on benefits and the longer they're disabled, the more revenue that is created on that side. So I have an issue with opposition on this, but not on the labor side, because I do think that they were completely genuine in the fact that their concern is with the individual worker. But I appreciate the fact that they were not directly opposed, because dealing with injuries in the real world in the business industry and where we work with SHRM and other organizations, there is a high increase in employees being addicted to opiates, and it is destructive in families. And this could be stopped if this formulary is allowed to be produced in a scientific-based manner that allows people to get pain medication without the addictive factor and complying with the original prescription. So thank you very much for bringing it forward.
Thank you.
Any other questions or comments? Would you like to close, Mr. Perea?
Just respectfully ask for an aye vote.
Thank you. Was there a motion and second that occurred? We have a motion and second. Let me just say, very, very well-crafted bill on a very, very important subject, and I think the concerns that have been raised, some of them are quite legitimate, and I think they can be addressed by the author and the whole advisory committee process, and I think he's laid out a great process for getting all the questions answered. Roll call vote, please.
Daly.
Aye.
Daly, aye. Beth Gaines. Travis Allen. Calderon. Aye. Calderon, aye. Cooley. Cooper.
Aye.
Cooper, aye. DeBobne. Aye. DeBobne, aye. Frazier. Aye. Frazier, aye. Gatto. Aye. Gatto, aye. Gonzalez. Grove. Aye. Grove, aye. Mays. Aye. Mays, aye. Rodriguez. Aye. Rodriguez, aye.
Bill has 9 votes. It's on its way. Thank you, Mr.
Very much,
Perea.
Mr. Chair.
Next in line is Mr. Chu, if he's here. Is Mr. Chu here? Mr. Sebastian Ridley Thomas.
I won't tell anybody.
Welcome, welcome.